So my name's Josh Bruning, and we are in my garage. Essentially, I started Total Tissue about 3 years ago, and it was just in a dinky little den. We lived in a townhome at the time, and we were fortunate enough to have the space where I was able to work on people still. I didn't really have a company name. I didn't wear a uniform or anything like that. And then I started taking things a lot more serious and realized that I wanted to build a much larger business with the product that I was creating. And so now everything that is in here, the cold plunge, hot tub, the infrared sauna over there, it's all just a product of feeding the business from the people that have come in and supported me.
When you say product, right, what is that you do?
So I have been kind of pioneering my own style of working in the soft tissue realm. So it's not massage therapy, it's not physical therapy, it's not chiropractic. We use a lot of myofascial release techniques, cupping, Graston, voodoo flossing, pretty much anything the body needs to allow the nervous system to get the response that we're trying to get. So I would say that we probably specialize with adapting with somebody's nervous system as opposed to one specific modality.
Who are like the type of people that usually come to you with this service or product that you offer?
It's changed over the years, but I'll start with answering, there's a couple different routes I could probably answer this. I'll start with saying the majority of our clients coming in are unfortunately typically coming from the traditional physical therapy model or run-of-the-mill rack 'em and crack 'em chiropractic model, and they weren't getting results or they stopped getting results, and so they're coming in for the alternative. They're used to 15 to 20 minutes of treatment, where here we have 2 hours of treatment with a additional hour of contrast therapy at the end of each appointment. So we get pretty good results with people. I would say roughly like 90 to 95% of people that come in we get results with. And of course that's not going to happen. Nobody's ever going to be 100%, and I think that's one of the things that a lot of people need to realize is everything works, but not everything works for every person, and people need to figure out what modalities are working for them and what their body responds to. And there's a lot of other education that we can dive into later on that can help people understand how to make those decisions. But the second route I think that I could answer that question with is a lot of people that are actively in the gym. So they don't need to be athletes. We do have a ton of athletes that come in, but just your everyday average Joe, for lack of better words, that is just interested in staying healthy and understanding how they can age better. Those type of people are starting to come in and they are seeking out information as to what do I need to do? Why is it that I'm 35, 40, 45 years old and it feels like my back is 80? And those are the things that we're trying to help people understand and provide a little more education with.
What is the most common myth that you hear that you debunk when they come here?
Oh, that's a good question. Injuries typically happen outside of the gym and not in the gym. And everybody is taught that the typical leg day, back day, arm day, bodybuilding split is how they are going to get results. And that is false. That is probably causing most of their issues because they're only moving in one plane of motion, right? And we have the sagittal plane, frontal plane, transverse plane. And most of the movements in the gym are sagittal. It's all out front. We're benching, we're squatting, we're moving up and down. Rarely are we ever going side to side, and even less with rotation. So, rotation, human movement is rooted in rotation. If we have a socket and a ball and socket, when we squat, it's a pivot up and down, rotating. So I think that's one of the key points that I try to educate people on is we need movement variety. 4 things I think that we should be focusing on. And the first thing is going to be making sure that we're getting recovery cardio in, because that's not only going to be great for your heart. If we want to live longer, like making sure you have a good VO2 max, like that's one of the biggest signs and one of the biggest things to keep up with. And it's also going to help with circulation, and circulation helps heal our body's tissue. So our DNA gets damaged over time, and one of the ways to repair that is through massage therapy, body work, contrast therapy, things that are constricting the blood vessels and veins and dilating them and forcing different hormones and proteins to be created to help the body heal. The second thing that I need people to focus on, or encourage people to focus on, is we need to lift heavy. So I'm not saying everybody needs to go be a power lifter and do a 1 rep max, but we need to pick up and set down and move heavy things. Even really heavy sled pushes would be really good, because it's going to help us develop better bone density. And as we get older, one of the leading causes of death in elderly individuals is falling. And it's not because of the fall, it's because of the complications that come after the fall, because they broke a bone or something else happens. So we want to be mindful of that, especially women. They're more susceptible to osteoporosis as they get older. So lifting heavy is important, and educating people that are worried about getting too big as to how that isn't going to happen unless they're doing all the other right things to make sure that's happening. It doesn't just like happen super easily. The third thing is we need to move explosively. So, I mean, we live here in Chicago, or Chicagoland area, and I don't know about you, but I probably almost fell on the ice this last winter like 2 or 3 times. And that is a fast twitch reaction. Or better example, people go to Topgolf in the summer, maybe 2 to 3 times a summer, right? And now they're doing a rotational explosive swing that they are not doing in the gym. Or they go and play a pickup game at basketball at 30, but they haven't played since they were 21 in college. And they, blow out their knee or sprain an ankle. And our tissue, our ligaments, our tendons, they need to be trained in order to handle that. We started sports probably around like 3 years old, and most people were in different sports their entire life, all the way up through high school. So it doesn't register that we can't just go run as fast as we can, because there's a very good chance that we're going to get injured because we haven't been sprinting like that. So, even just doing things like jumping rope, single leg hops, jumping off of a box and landing. I mean, there's a lot of different progressions that we should be mindful of to where you're not going to get injured. And the fourth thing is movement variety. That's the biggest one. And that's why I leave it for last, because movement variety is key. If we are not moving with enough variety, then our body it's going to be stiff. It's going to feel like it's limited. And when it comes to mobility and range of motion, the saying of if you don't use it, you lose it is very true when it comes to that. So we have to just simply access certain ranges of motion. I'm not saying we need to go lift heavy in every single range of motion. Like, you can have your primary lifts with heavy weight in your typical bodybuilding form if you wanted to, but all of your feeder sets and warm-up sets and cool down things, they should look odd. They should turn heads in the gym. People should go, what is that person doing?
So with all that said, and you've brought all your experiences into your own business, so what makes Total Tissue unique?
The first thing that probably stands out to people is the fact that we only offer 2-hour sessions. And by the time you finish your full session, it's roughly 3 hours by the time you add in your contrast therapy, which is probably the second thing. To my knowledge, we're the only company right now that is doing aggressive soft tissue work and then immediately putting people into contrast therapy the way that we implement it here. So that's going to be going into your cold plunge, immediately into your hot tub, and then finishing in your infrared sauna. The thing that I think makes us the most different is the fact that my background starts with strength and conditioning. And then I moved into working in a clinical setting as a PTA for a chiropractor. So implementing the corrective exercise or physical therapy related movements with the soft tissue work, with the advisement of things that we can do in the gym. And we recently just got a bunch of exercise equipment for the studio here where we can start teaching people some of the movements that we do in the gym in addition to the things that they're currently doing. Because I don't want to necessarily change and take away what people are doing for their training programs, but I want to supplement it. I want to educate them, get them doing things differently. So we offer all of this underneath one roof. And I think a lot of people are very used to having to piece it together and going and getting their different services from different people.
Yeah, so in other words, you're kind of like an all-in-one studio or, space, I guess.
We're doing our best to be like an all-in-one, like you can get whatever you need here. So to give people a visual, there's roughly 110, 120 square feet of a den that I work out of doing the body work. And then the space that we're sitting in is roughly 600 square feet. And we have a squat rack, we have a GHD reverse hyper Nordic machine, we have a C2 rower, a C2 bike, we have a C2 ski erg. We're also in the middle of getting a free runner treadmill that has a magnetic sled resisted push on it as well.
That's cool.
Yeah.
Yeah, I think anybody who's interested in, just coming here and just getting inspiration of a space, like this is cool, man. Like,
thank you.
Definitely man cave vibes to the next level.
Yeah.
So what are reasons why people should be educated about what you do? Because I feel like soft tissue is still very new in this space. What do you want people to know about you?
I think the first thing that comes to mind when you ask that question is people that are getting surgeries. There's a ton of people, there's a ton of, let me be careful how I choose my wording here. There's a lot of people being led down a path that they're being told it's the only path when it comes to surgeries, with things like carpal tunnel, trigger finger, degenerative disc, things like that. People are getting fusions, they're getting the disc chopped off. There's so many surgeries that are happening unnecessary. Unnecessary surgeries are happening, and that's probably the biggest educational piece, if I could give to people to focus on that's considering surgery, is you need to explore the soft tissue route. Because I've seen people with hip impingements and shoulder impingements that normally would take 6 weeks with physical therapy, with the traditional run-of-the-mill physical therapy, and it's cleared up in half an hour, but it's very painful. And then, the symptoms are cleared up and things are always gonna come back unless we change the mechanics. So that's where the corrective exercise and what I like to call hygienic movement comes into play.
Can you give kind of like a case study or a specific patient that had a surgery, was dealing with something, but then came to you and saw a massive change?
That was considering surgery or has had a surgery?
Both. Either
I have a knee replacement client. She's had 2 knee replacement surgeries, and the first one resulted in a peg leg, and she had less than 20 degrees of movement and was walking around like a pirate. So they redid the surgery like a year later, and they were able to get her to about 60 degrees. They also had to do a manual reset where they go in, they put her under, and they force the leg to bend. And they've done that twice, and she still was roughly at about 68 degrees after that. So I've been working with this individual for almost a year. It'll be a year in May, and science will tell you if you have a contracture that nothing will change it. We've gone from 68 degrees of knee flexion. This is after being in physical therapy for a year and a half. She comes to see me, and now we're at 85. So the first goal is 90, second goal is 120, so that way she can ride a bicycle. So we're slowly inching our way there, but that's been, twice a week, every week.
Wow. So you obviously have very aggressive cases like that. Who are some of the current customers or clients coming in for, and what would you like to see more of? So 2-part question there.
Okay.
So what are your typical clients like, right? Because
Yeah.
I was a patient, I'm still a client of yours, right?
Yeah.
and I just kind of get my general tune-up, what are your ideal customers now?
Most people are coming in, again, with something that they haven't been able to solve through traditional physical therapy or chiropractic. And we have a much longer approach, of a much longer treatment time. And I think that plays a role in the results that we are getting with our clients. Are coming in with low back pain, neck pain, shoulder pain, elbow pain, hip pain, knee pain. Those are, the primary things that people are coming in with. We really don't get anybody that is just looking for a massage, right? And that's one of the things I'm actually pretty proud of, is when people reach out to us, they're not asking for a massage. They are looking to get help where, other people have failed helping them. And that's a lot of pressure on us, because I'm very honest about my background. And the thing that I appreciate about where people are at nowadays is people just want results. They want to know that you can do the job and that you can get them a result. They don't necessarily care too much about their credentials. Credentials are important, don't get me wrong, because you want to make sure people understand what they're doing and that they're not going to hurt you. But it's no secret that I'm not a chiropractor, I'm not a physical therapist, but I am friends with a lot of chiropractors and physical therapists, and they are, let's just say, when we have conversations, I can keep up pretty easily. And I'm pretty proud that we've been able to build this construct, or the way that people view us when they're coming in for an appointment, because it's not just like, oh, I'm just gonna go see my masseuse. Like we are able to really help people that have been struggling with things, some people for decades. Yeah. And we're able to start clearing those things up. And but I also want to add that we're not batting 100%, and nobody is. And if they tell you they are, they're lying to you just so they can get money. Yeah. It can be a complicated and complex system to solve somebody's pain, and what's causing it. So we're still striving to do more, learn more. I just signed up for a mentorship that's actually only for physical therapists. I actually called the owner and told him my background and what I currently do with my business, and he was impressed and he let me into the program, which is pretty cool. So I'm flying out to Denver on the 3rd of May for our lab week. It's a three-day weekend, and I'm stoked.
That's awesome.
We're about to change the game on how we actually work with clients coming in, and the results that we're going to be able to get them.
You're about to change the game, so who would you like to see more of coming into Total Tissue?
That's a good question, because when I think about, essentially it's kind of like, what's the niche, right? Or the niche, right? And I think when you go looking for one, you're throwing stuff at the wall and seeing what sticks. And I think you just kind of gotta let it find you. So what I'm seeing more and more of is people that aren't into fitness currently, but they understand they need to change something. And I really like that, because we have the ability to get them out of pain and educate them, like green blank slate. We are able to educate them on how they should be approaching the gym. So I would love to see more people that know they need to make a change, and they're just confused on where to start, and that just leads to them procrastinating and not getting started because they just don't know what to do,
Yeah, definitely. I feel like that's a very common thing for a lot of people, right?
Yeah, and not just with fitness, right? Like with anything in life.
Right. What are some dysfunctions that people are coming in for?
So a lot of people, they lack mobility through their thoracic spine, through their shoulders, through their hips, and this causes a ton of issues. This causes the impingement syndromes, and this causes the random aches and pains and clicking and popping that people are like, why is this happening? So most of it is, shoulders, necks, low backs, hips, knees. And if we can start helping people understand that we just need more movement variety after we've figured out, okay, what movements are not causing pain, what movements feel productive and are helping clear the pain up. And what we're trying to do our best at right now is, one, we can't diagnose, right? I'm not a doctor, so I'm not going to step out of my lane and tell somebody this is what you have going on. But what I am very good at is understanding that if you have a neck issue or a shoulder issue, I can tell you the top 3 or 4 things that are going to potentially be contributing to that pain, and then we can go and test and try to address those things.
What is your process like when someone new comes in for the first time?
Yeah, so when somebody new comes in, the first thing we're going to do is we're going to fill out our intake form, and then we're going to kind of discuss, what are the aches and pains, not just the primary thing that you're here for, but what are all the other things? So that way we can start piecing together this puzzle as to what might be causing what could be contributing to this or that. And the first thing we're going to do is we're going to try to recreate the pain that you're having if you're not in it. So if you have pain in your low back when you squat, I'm going to put you in a squat and I'm going to try to replicate that pain. And then after that, we're going to do isometrics or different activation drills to see if we can clear that pain up through movement. Because if we can, that lets me know that it's more of a mechanical issue and less of a structural issue. And that gives me an idea of where I should start. If we can't clear it up, then that tells me that it's more of a structural issue. And so then that's where I'll dive into the body work. But what a lot of people don't realize and what they're expecting, and what I try to educate them on whenever they come in, is if you come in with shoulder pain, we're not going to touch the shoulder first. We're going to go to all the other areas that are potentially causing that pain, because once we do that, then we can start testing and retesting on and off the table if your shoulder pain or your back pain is getting better. And then we'll dive into the symptomatic area. But a lot of people, that might be one of the myths that we have to debunk, is a lot of people focus on the symptoms when the symptom is not the issue. The root cause is causing the symptom, and the root cause is, it's hiding. It doesn't want to show its face. So you have to do a little more work to figure out what that is.
What's the typical feedback you get during a session with someone who's new, and some of the feedback that you get like a couple days after?
Yeah, I think a lot of people are shocked at how painful it actually is. And we're very honest with people before they book, when we do a consultation over the phone, and let them know, like, hey, this isn't going to be a walk in the park. Like, we're going to work with your nervous system, but you're going to have to grit your teeth through some things. So the feedback during is just, some people have been overwhelmed with it, and then they tell me that on the second session, which is fine, but they did a good job at hiding their pain. They also did a good job at not tensing up and actually staying relaxed through some of the work. But I would say the majority of the feedback, especially when people finish with the cold plunge, hot tub, infrared sauna, and then they're on their way out the door, I'm already working on my next client, and I go, how do you feel? And they're like, oh, amazing. Like, they feel so refreshed, so energized. And then in the following days, when I text them and say, hey, how's the body feeling post-session? Usually the first response is sore. But I would say 90% of people follow that up with, I don't have this clicking or popping, or I don't have this stabbing feeling anymore, I don't have this type of pain, or it's significantly less, which is always amazing feedback. And from time to time I get some really touching reviews of just, like, God bless you, like, this is amazing. I've been dealing with this for 10 years and I just can't believe that it's gone, stuff like that. Like,
yeah, I've read some of the reviews from the things that you've sent me. It's pretty amazing. You're getting great responses from people trying out your service. How often should people be coming in for something that you do?
It's going to be dependent person to person. So I never give anybody the same prescription. And that's going to be dependent on, do you still have residual pain? Is it significantly less or is it the same? If the pain is completely gone, one of the things that I really try to educate people on is to treat their body the same way they treat their car and changing the oil, right? We don't wait for the engine to blow up to change the oil. But what most people end up doing is they treat their body like they treat their furnace, and they wait for the furnace to go out, and then they call somebody and go, oh, I need a new furnace, or I need somebody to come service it, right? And that's what we do with body work. So typically, once or twice a month is gonna be healthy in the beginning. After that, then it's gonna come down to, well, how good are you at corrective work? How good are you at hygienic movement? And when I say hygienic movement, think about when you first sit up out of bed in the morning, I'm assuming you probably do one of these or one of these, right? Most people do. And that to me is hygienic movement, because you're taking your body through a range of motion, you're prepping it and getting it ready to move. So throughout our day, we should be doing different shoulder cars or thoracic rotations and things that I truly view no different than how you brush your teeth and take a shower. So if people are good at that, then we can start pushing sessions out 6 weeks, 8 weeks, 10 weeks. Some people come in like every 3 to 4 months. And do I think that they could come in sooner than that? Sure. But as long as they're being proactive, it might be healthier for their tissue if they came in sooner. But as long as they're not reacting to pain, I'm okay with it.
What's a common problem that you see in this current industry that not many people are talking about?
I think there's two things. So I want to cover both of them. So the first thing that I don't think enough people are talking about that's happening within the industry is.
And when you say industry, can you specify which industry?
Within the recovery industry of chiropractic, physical therapy, massage therapy. For one, massage therapy school, and I'm sorry if this offends any massage therapists out there, because I'm also a licensed massage therapist, but it's a joke. And I was not impressed with the schooling that I went through, and I was not impressed with the NBLEX either. We are wanting to be recognized, massage therapy is wanting to be recognized by the medical community, but then most of school is teaching how to do a Swedish massage. In your clinicals, you're in a room by yourself with the door cracked and your instructor peeks in on you. Where if you're in physical therapy clinicals, your physical therapist, or if you're in chiropractic clinicals, they're observing your treatment and still teaching you things, right? I think that's one thing that I don't like about the industry, because a lot of people are being pushed into physical therapy, chiropractic, dumping $200,000+ on 7 years of education. That's actually after the 4 years of undergrad, and then another $200,000 on top of whatever their undergrad costs. And they're teaching stuff that is based on information from like the 70s and 80s. Could you imagine driving around a vehicle from 1970 right now? Right? Like, it's just not the same. So why are we teaching that and having them take boards and exams on that when all of the continued education is teaching almost the opposite of what is being taught in school? So now these people are being fed to feed, or being bred to feed the system. And the system is the insurance companies. And they're going, well, you have a knee issue, so your physical therapy is only allowed to address the knee. But everybody knows, even people that aren't educated, I feel like, know that if you have a knee problem, it's coming from the foot or your hip. The only time it's gonna be the knee is if you directly had like a impact on the knee, car accident or sports injury, blew out the ACL. So that's one of the things that I feel like is not being talked about and addressed. We're just feeding more people into the system, and it doesn't make sense, because then we're just getting more and more people frustrated because they're not getting results. They're being fed this cookie cutter approach to corrective exercise or physical therapy, and And I think that needs to change, and I'm glad that there's people starting to pioneer that. I'm just wondering when the schools and educational system is going to, change their standards and what needs to be taught. The second thing that I don't think is talked about frequently enough with service providers, and this is going to ruffle some feathers, more than likely. And this is just my perspective, and I want everybody to keep in mind that's listening that this is how I personally choose to treat my service providers, and it's not a reflection of what we necessarily expect here. It's just my mindset, and I think that it's appropriate, and it's cancellation and the cancellation policy. So if I'm working 8 hours in a row, which is what I do every day, so no breaks, and you're scheduled at 10 a.m. tomorrow, and you cancel at 10 a.m., I can't even get to that message until 6 p.m. when I finish work. And then I gotta go pick up my kids, bring them home, get them ready, put them to bed, eat dinner, and then go and create a post and then try to fill that spot. Now I'm left with 10 hours to fill a spot when it was a 24-hour cancellation policy, right? So I don't have 24 hours, I have 10 hours. And most people would agree that when you make an appointment, it's not the day of or the next day. It's like a week in advance, 2 weeks in advance, sometimes a month in advance. So 24 hours is not realistic for a service provider unless they have an assistant that is able to immediately start making phone calls and try to get that spot filled. So we ask for a 48-hour cancellation policy. The other thing on top of that is I think no matter what the reason is for cancellation, if I'm going to get my hair cut and my truck breaks down on the way there and then I can't go, I'm gonna pay my barber what it would have cost me to get my hair cut because that's how he pays his bills and that's how he provides for his family. And of course you could argue that there needs, well, they should account for that. I mean, sure, like you should account for unfortunate circumstances, but at the end of the day, I look at it as like I took on the responsibility of reserving that time slot within his business. And I basically had a handshake contract of I'm going to help feed your business and how you pay your bills, and you're going to provide a service for me. So if that gets taken away, and then that happens 20 other times, roughly 10% of a service provider's appointments will probably reschedule or cancel throughout the month. An inconvenient $70 for me turns into a couple hundred or thousand for the service provider. And again, this is just my perspective. So that's how I choose to do things. So something catastrophic happens, like of course I get it, but at the same time, before I jump to conclusions, I'm always going to ask for a phone call. So that way we can talk on the phone and go like, hey, what happened? Why couldn't you make it? Why couldn't you tell me? Because what people don't get is it's the mental energy part. When somebody no-call, no-shows, like that is the biggest slap in the face. Even, it doesn't matter what the reason is because I wasn't informed, the service provider wasn't informed of what the reason was. Their brain immediately goes to, why is my client not here? And not always, like it's usually first, I hope everything's okay. I hope there wasn't an accident. I hope, something crazy didn't happen on the way in. But then when you get that message, and oftentimes it's more like, oh, I got busy at work, or this happened, or, oh, I got sick, or what are some of the other ones? I overslept, stuff like that. And it's like, I don't even want to work with that person again. Like I don't need you to be part of my business. I don't need to take that chance on you coming in. And it's not about the money at that point. I don't need you disrupting my mental energy that I should be giving to the rest of my clients and to my kids and to my wife. Like that's the way that I see it. So I think like no-call, no-shows and cancellation policies altogether are probably something I think needs to change as a whole and how people address them, because we have a lot of practitioners out there that are basically and unfortunately probably in a position where they can't lose the client and they need the money, so they're forced to take whoever they can, and they end up getting walked on. And that allows other people to continue to do it to other service providers until somebody puts their foot down and says, hey, this is inappropriate. So you either need to pay me for the time or don't reach out again. You know, and I've been in that position, unfortunately, a handful of times over the last year. Let me say one last thing. I think the biggest thing, like, we need to, as a whole, service providers everywhere need to remove the 24-hour cancellation policy. It's just not realistic, and not enough people have an assistant trying to fill that. And even if you do, again, it comes down to the fact that most people have to plan in advance because they have kids and family and jobs and everything else, and it's just not super easy to fill something last minute.
What has this business done for you and your lifestyle?
It's given me like mental peace is probably the biggest thing. I mean, don't get me wrong, it's stressful. Like, I still stress a lot about getting new clients in and running ads and, you know, getting Casey more clients and bringing on another person, and, you know, some of the goals that we're working towards right now, just for expanding and, you know, financially and stuff like that. But the biggest thing is this was the first year ever that I was able to go home for a week during Thanksgiving and Christmas, and I didn't have to worry about anything besides if somebody needed to reschedule for the week coming up, because I already have my entire schedule booked out about 4 to 5 weeks in advance. And that in itself is amazing, because I had never been able to take a trip home in the last 7 years and not have to stress about doing work. And, you know, for my lifestyle, it allows me to pick up my son and take him to KidStrong, and allows me to hang out with my daughter, and allows me to put them both to bed and be with them in the morning and take them to their grandparents when we wake up. I never would have been able to do that 3 years ago.
What was done differently this year comparatively to the first 2 years?
With business?
With business, yeah.
Working with you.
I appreciate that.
Yeah. Working with you is what made things much easier, because we were able to actually get our product out to a lot more people and not solely relying on the word of mouth. And word of mouth is amazing, but when you can reach thousands of people in a couple of hours, that also is pretty impactful on top of the word of mouth.
To wrap things up, what are some upcoming goals now that you're seeing for the business?
In the future, the next goal is to get into a commercial spot. So I don't know what that looks like. I still would like to work out of this location, but a commercial spot could just be another 700 to 800 square foot location, and plugging more people in and teaching them how we practice. And the next thing, actually, that just triggered a memory, or not a memory, but just triggered me to think about, is we are creating a CE course for massage therapists, which is continued education. And it's going to have a plethora of things that actually aren't able to be credited for massage therapy continued education credits, but will help people get better results with clients or patients if they happen to be working underneath a chiropractor somewhere. And I'm very excited to launch that course, because it's going to have a combination of all the things that I've been doing with people and the things that Casey does with people now. And we're going to be able to start getting that out to more people, and I think that's exciting. But end goal, you know, we invested in a lot of gym equipment in here to be able to start working on training. Not so much goals of doing personal training, but training education. So doing, you know, 1 hour sessions here and there, giving people a different toolbox of exercises that they can pull from when they're in the gym. I don't necessarily want to walk somebody through their weight loss journey. That's not where we're focused at anymore. But So with that said, I think it's fair to say that at some point we will have the body work, the contrast therapy, and a gym underneath the same roof.
Cool.
In a commercial setting.
Yeah, that's super exciting to hear everything
Yeah.
come together. Where can people find you right now? Like just
Right now, they can find us on Instagram primarily, and that's total.tissue.havoc. And they can just shoot us a DM from there. Outside of that, we are about to launch a new website